Hello everyone, welcome to the new topic of drug elimination. Let's imagine that we wanted to understand the pattern that a drug follows as it is eliminated from the body. One way we could do this is to inject the drug into the bloodstream and then monitor the concentration of that drug over time. So let's imagine that at time 0, we inject the drug into the bloodstream. Of course, its plasma concentration will high in the rise up to some high value. We could then follow to the concentration over time, and concentration will become to fall as the drug eliminated from the body. And there are two typical patterns that drug follow as they are eliminated from the body. The first pattern is called zero-order elimination, and second pattern is called first-order elimination. The zero-order elimination is a constant rate of elimination by time, and it did not depend on the concentration of drug and variation of concentration, and it having no constant half-life. Actually, the zero-order falling plasma concentration is a straight line as shown here. In zero order, the graph mostly shows the straight line that I've already mentioned in the book. And secondly, if we check, it is on the x-axis there is a time, and on the y-axis it is the drug plasma concentration. We injected the drug and it reaches a high peak. After some time, it will become 2UH eliminated. For example, I will make some number like we having 20-gram drugs. After some time, it will become in the first half-life 15 gram. And according to this elimination, a constant amount of drug will be eliminated, and it depends on drug to drug. Like in this drug, the 5 gram will eliminate in each half-life. So from 20 gram to 15 gram in first half-life, first 5 gram are eliminated. Then second half-life, the 15 gram, and this will be the 10 gram. And in the third half-life, it will become the 5 gram. Okay? The main thing, the important points in zero-order elimination is that it having the constant rate of elimination per time. The zero-order having the constraint rate of elimination per time. Like me showing the graph for the 5 gram. Okay? And it does not depend on the concentration of the drug. As you guys see, we have in a 20 gram and the high concentration, then we have in the 10 gram. It's a low concentration, but the elimination is 5 gram. Here also, and even after the second half-life also. And secondly, it did not have constraint half-life. It's vary time to time, and it depends on the concentration. The time of half-life is decreased as the concentration it decreases. Actually, in zero order eliminating zero order, the elimination directly proportion to the concentration of drug in plasma. For example, in the first, we have in the 20 gram, we having, for example, it's a 0 seeking, it is a 1 on, it is 2 on, it is 3 on, and it is a 4 on. Full eliminating 5 grams from 20 gram to 15 gram. This system take 2 odds. Fine, it take 2 odds. But when the concentration is 15 gram and we have to eliminate 5 gram from 15 gram, then it takes only 1 odd. And after that, when the concentration 10 grams and we have to eliminate the same amount, 5 gram, then it only takes the 30 minutes. So the half-life is not constrained in zero-order elimination. It varies according to a concentration of drug in the plasma. There is no single value for half-life, and half-life depends on the concentration. If you have loads of drug in the plasma, then the half-life is relatively long, like 2 hours. If you have fatty lipid drug, like a concentration of 5 grams, then the half-life is shorter. So half-life always changing and depending on how much drug is in plasma. Now, we will move to the first order elimination. The first order elimination, the rate varies with the concentration of drug. A rate to first order elimination is directly proportional to a drug concentration. It's directly proportional, and I mean the constant fraction of drug eliminated per unit time. And it eliminates the constant fraction, and it is generally eliminating the constant amount. For example, 5 grams, it's a constant amount, but here, like 20%, 50%, like that, a constant fraction. And in this, if the concentration in the plasma decreases exponentially with the time, then it applies to most drug. Actually, in this treatment means, in the first order elimination, the drug eliminated fastly as compared to zero order elimination, because in first order, about 50% of drug will eliminate it in first half-life. But in zero order, only same concentration like 5 gram. If you are injecting 100 gram of one drug, only 5 gram will eliminate it. Still, 95 gram is there. But in the first order, but the drug that follow the first order, if you are giving 100 gram after the first half-life, it becomes 50 grams. So it having a less risk for the toxicity, and most of the drugs apply the first order elimination. And for that, if we check is graph for the first order elimination, then you can check, same on the x-axis we have in a dime, on the y-axis we have in the drug plasma concentration. On the first, at 16 and third, we having 20, for example 10 gram we having here. After the half-life we having 5 gram, after that we having 2.5 gram, and after we having 1.25 gram. And for example, with a 0 odd, it's a 1 odd, 2 odd, 3 and 4 and 5 hours. If you check, every half-life is taking same time, no? Like the first half-life is taking 1 hour, second half-life also is taking 1 on. The third half-life after taking 1 on. So, in the first order elimination, you have into constraint half-life. And seeking that elimination depends on concentration of drug. And seeking, most of the drugs are involving the first order elimination and is eliminate the constraint fraction. And goes why we 80,001 question, why we answered first order elimination. Actually, the first order elimination, a redefined elimination, it literally equals to dead fraction. So, because it's eliminating, elimination rate is equal to some constant C, that times the drug concentration raised to the first power, that is constant C, having the power of 1. So we are saying first order elimination, and therefore drug concentration influences the elimination. When the drug concentration increases, the elimination of drug will also increases. When the plasma concentration of drug is decreased, the elimination rate will also decrease. But the half-life remains same. Okay? Again, I'm writing the same formula. Net force. One formula that would read is equal to C constant times the concentration of drug with the power of 1. Okay? This is a redefined elimination according to first order elimination. Let's make a comparison between two tables. I have in the first table, it is 0 order. For example, on the time 0, we have an amount of 20 grams importing the plasma. After the first half-life, we having the 15 grams left. And we having the change of 5 grams. Because in the little order, we already know that there's a constant amount of drug eliminated per unit time. So in every half-life, we having the constant amount that is in 5 gram, 5 gram, 5 gram. And by in second, it is getting 10 grams. And in third half-life, we are getting the 5 grams. So the change in percent is 100% to 75, 75 to 50, and 50 to 25%. But in the first order reaction, first order elimination, you have an amount of 10 gram. Fine. After the first half-life, that's a constraint, you get 5 gram of drug. And the 5 gram eliminated. But it eliminated 50%. Again, in the second half-life, you get the drug of 2.5 gram, and the change is 2.5 gram, and the change is 50%. Half of 5 gram is 2.5 is eliminated the same. After third half-life, 1.25 is 1.25 is eliminated, and 1.25 in the body, the change is 50%. So in the first order, there is a constant friction for drug eliminated per unit time. And seeking, during these all, During these all of the elimination dates, a special type of eliminations. One is a flow, one is called flow dependent, and second is contact capacity dependent. The flow dependent elimination is depend on the blood flow to the organs that are responsible for the elimination, like the kidney and the liver. The flow-dependent elimination is metabolized so quickly that blood flow to the organ, usually to the liver, determines the elimination. These drugs are high restriction drugs, undefined. For this, we have an example of morphine and patient with a heart failure. Patient with a heart failure having the less and the low clearance rate. Low clearance for drugs that follow the flow-dependent elimination and is depend on flow blood to liver and kidney. Second type we have is capacity-dependent elimination. It follows on Meckel's Menten kinetics. We already done in the enzyme kinetics. You can go in the watch that video. The rate of elimination is equal to Vmix multiplied by the concentration of the drug divided by the Km constant, adding the concentration of the substrate or the product. In that, if you have the high concentration of saturated bulb, if you have a high concentration of a drug, then the elimination will be maximum. The elimination will equal to Vmax. How? We already studied that in the Michaelis Menten kinetics, a kinetic if the value of substrate is higher than Km, then we neglected the Km and the equation becomes Vmax multiplied by concentration of substrate divided by concentration of substrate. If we cancel each other, and elimination will be equal to Vmax. So these eliminations are followed by the zero order elimination, and there are three classic drugs that followed at ethanol, aspirin, and phenidrine. And at a high or a toxic concentration, these drugs can cause toxicity. In the last, if we summarize zero-order reaction with the first-order reaction, then if we talk about the half-life, the zero-order elimination don't have a constant half-life, but the first-order have the constant half-life. The amount is a constant that is eliminating per unit time, but the first-order reaction is a constant fraction that is eliminated per unit time. And secondly, it is in zero order the high chances of toxicity, and in first order the less chance of toxicity. Thirdly, the zero order did not depend on concentration, did not depend on concentration of drug, but the first order reaction depends on the concentration of drug. Already we know the formula that rate is equal to C constant by the time of a drug or constraint, drug concentration with the power of 1. So if the concentration of drug is changing in the plasma, the rate of first order elimination is also changing, but it's not having any relation in the zero order. Zero order having no relation with the concentration of drug in the plasma. If we have to study again the Ryan's rate of first order elimination directly proportional to a drug concentration and having the constant fraction of drug eliminated per unit time, and we already know the concentration will decrease with the time because large number of drug is getting eliminated, and most of drugs is 5 in first order elimination. It is a flow dependent elimination. The first order is flow dependent elimination, and zero order is a capacity limited elimination. The urine pH, the high will drop if you strip thin. And drug elimination. In these main drugs are weak acid and weak bases. First, we have to know about what is the weak acid and what is the weak base. The weak acid transform into an anion and hydrogen positive, and the weak bases, after the reaction, convert into a positive cation plus hydroxyl. Basically, the concept of the urine pH drug elimination is that drugs are weak acids and some are weak base. For this, for example, if you're having the weak acids, for the weak acid, the elimination of the drugs that are weak acid, we have to alkalize the urine. And for the weak bases, for the elimination of the drugs which are weak bases, we have to acidified urine. So it is the main concept. For the elimination of weak acids, we have to do alkalization of the urine. And for the weak bases, we have to do acidification of the urine. And the drug is filtered by the glumoners, and the ions from get trapped in the urine after the filtration, and they can't diffuse back into circulation. So for the weak acids and weak bases, for the elimination of weak acids, we are going to alkalize the urine, and for the weak bases, we are going to acidify the urine. And secondly, we have an example like the phenobarbital, methotrexate, aspirin, and these three with the overdose. If you are having the overdose of phenobarbital, aspirin, we can treat with the sodium bicarbonate. And sodium bicarbonate, it's an alkaline compound, and we are giving the alkalization of urine. Alright, here I told you this thing. For weak acid, we are going to alkalization of urine, and for the weak bases, we are doing acidifying urine. And this is about all the things. And for the weak bases, we have index the example tricyclic antidepressant, amphetamines, and if they trapped in the acidic environment, for severe alkalosis, we can be treated with ammonium chloride to acidify the urine. For elimination of weak bases, we can use the ammonium chloride, and for the weak acids, we are giving sodium bicarbonate to alkalize the urine. There is one word, the pKa. It is the pH at which the drugs become 50% ionized and 50% non-ionized, and it represents the strength of the weak acetone base. Like a small or less pKa represents this drug the more acidic, it having a substance having a high pKa, then it is more basic and in simple value, and that gives the strength of acetone base. On pKa, the drug converts 50% into ionized form and 50% unionized. And it's all about the using pH and drug elimination. Again, I am repeating, if you have to eliminate the weak acids, you have to do alkalization of the urine. And if you want to eliminate the weak base, you have to do acidification of urine and alkalization by sodium bicarbonate and acidification by ammonium chloride. That's all about the urine pH. Now we are going to study about the efficacy and potency. What is efficacy? Efficacy is the maximum effect of a drug that can be produced. It's the intrinsic activity. For example, we are giving a maximum dose and this drug giving a maximum effect. After giving the highest therapeutic dose, the maximum effect is called efficacy. And street the potency means via I am taking two drugs, drug A and a drug B, after giving 10 grams of this and 10 grams of this. And after they injecting drug A, I am getting my desired effect. For example, this is my desired effect. And after indicating 10 grams this, I am not getting a desired effect. I am getting only this much effect of this. After injecting drug B, the more potency will be drug A. Okay? The drug A and the potency means getting desired effect with minimum dose of drug. Okay? And the maximum effect the drug can be produced is called efficacy, and it is represented by the Y value Emax on this graph. And the Y value increasing equal to efficacy, the maximum in efficacy increasing unrelated to potency. Efficacious drug can have the high and low potency. Partial agonists have like efficacy than the full agonists. You know, agonist is a substance that give the effect same of that drug. If you're giving the agonist, full agonist, then it having the highest efficacy, but for the partial agonist, having less efficacy. If me come look on this graph, then the x-axis having the low or drug dose and the y-axis having the maximum effect. This is the time we are giving dose in a drug, and with the time the drug is increasing, okay? And after that, it is collecting to a maximum effect of 100. Same for the drug, I injected that drug in the body, but after passing the same time, it is giving minimum effect of 50. The maximum efficacy having by the drug A, not by the drug B. Okay? But instead, there's the potency. The potency is the amount of drug. Potency is amount of drug needed for a given effect. It is a minimum amount that keep the desired effect. That is that drug having a many maximum potency. A drug with minimum dose give the desired effect. Is having maximum potency. It's represented by the X value. Like on x-axis, we having the drug dose at hand. On y-axis, we having the maximum effect. Left shifting, it decreases the efficacy and increasing potency. Decreasing drug needed. Unrelated to efficacy, the potent that can have a high and low efficacies seem like that. If a drug is having a maximum efficacy, it not mean it is having highest potency, okay? Same with the potency, if one drug having the highest potency, not mean it is having maximum efficacy. Same like that, if you guys noticed, we injected drug A, and we want a 50% effect for the 50% effect for the headache. For example, I am taking the paracetamol and I need the 50% effect to get cured from the headache. After injecting drug A at 5 grams, I am getting that effect. But after injecting drug B on the 10 grams, I am getting that effect. So the more potent drug A, this is all about efficacy and potency. Efficacy, the maximum effect of the drug, can be regulated non-dependent on the dose, how much dose is that drug is using to get the maximum effect. what the potency means. Undesired effect is getting in minimum dose of the drug. Again,